lacking behind.
Just ignore me.
We are not live. It's lacking behind.
Yeah, it does lag.
Hello and welcome to the Healthier Weight session this evening. My name is Rishi Singhal. I'm a consultant bariatric surgeon and I'm going to talk to you about
Just ignore me.
weight loss surgery and any other questions you may have about weight loss surgery. We are not live. It's lacking.
Yeah, it does lag.
So I've received this question and welcome to the Healthier Weight session this evening. Bypass, sleeve and band. So I think let's start with this. And my name is Rishi Singhal. This is one of the basic questions that most patients talk to you about. What are the different types of surgery and any other questions you may have about what are the common procedures and what's the differences between it? At Healthier Weight, we are offering the most common procedures that are offered in the UK. Offer that. So I've received this question and welcome to the Healthier Weight session. The three most common procedures now in the UK. I think let's start with this. And this is one of the basic questions that most patients talk to you about. Initially, there used to be a classification of these types of surgeries, many involve absorptive procedures, but all of them we know have a part restrictive component. At Healthier Weight, we are offering the most common procedures that are offered in the UK. Offer that. So I've received this question and welcome to the Healthier Weight session. The three most common procedures now in the UK. I think let's start with this. This is one of the basic questions that most patients talk to you about. Initially, there used to be the gastric band. The gastric band is one of the simplest operations we can talk about. It involves putting a band on top part of the stomach like this. I'm not sure if you all can see this, but this is the gastric band that is placed on top of the stomach and it is connected to a tube. Between most common procedures now in the UK. Let's start with this. How does this manipulate work? I think that's the first and most important question. Initially, they used to be the gastric band. The gastric band is one of the simplest operations of the stomach, and it's distended putting a band on top part of the stomach like this. I'm not sure if you all can read telling you you've done it. This is the gastric band that is placed on the band. You create a smaller pouch on top of the stomach, which is a virtual pouch or a micro pouch. How does this manipulate work? So when the food goes through this part of the stomach, it distends this band. The gastric band would go without you get an impulse into your brain, telling you that it's putting a band on top part of the sleeve, and the gastric bypass works just like telling you you've done it. In a sleeve, we remove around 80% of the smaller pouch. So to show you what happens in a sleeve, take away this bit of the stomach completely. So when the food goes through, it works in two ways. It reduces the size of the band. At the same time, fundus or this part of the stomach secretes the hormone ghrelin. Now, ghrelin is a hormone that makes you in a sleep. When you remove this part of the stomach, your appetite actually goes down and has it take away this bit of the stomach completely. The gastric bypass is an operation in which it is essential at the same time a rearrangement of the anatomy of the stomach. So you make the stomach much smaller and you connect it to the intestines directly. One, the capacity of the stomach is very small, but also as a result of the gastric bypass, there are powerful hormonal actions which get rid of your diabetes, which improve your comorbidities, and you lose a lot of weight. So there's another question coming in from Janet now, which is how much weight can I expect to lose? Weight loss is variable, but however, to go to the beginning of weight loss, I think all the data that we have worldwide has been obtained from a large group of patients, which includes patients who are young, patients who are old, patients who have a lower BMI, 35, 40 BMI, patients who have a very high BMI, which may be 80 BMI. So weight loss results have actually been calculated as an average of these figures. So it may not be completely true for you. It is only a guide. A patient who has very high motivation may lose a much higher amount of weight as compared to a patient who has lower motivation. Similarly, a very old patient may lose maybe less weight as compared to a patient who's relatively young because their activities are different. So with the gastric band, you can expect to lose around 50% of your excess weight at 3 years or so. With the gastric sleeve, I think 70 to 80% excess weight at 3 years. And with the bypass, again, 70 to 80% at 3 years. We speak about excess weight loss, which is your excess weight that you're carrying. So there's an ideal body weight and there's a current body weight. The difference between these two weights is the excess body weight, and the excess percentage weight loss is a percentage of this excess weight that you will lose. And that is how we define it. We have a question now coming over from Denise. How much will I need to change my diet post-op? I think it's important to understand that bariatric surgery is a lifestyle adjustment. You have come to us or you have asked for help because you're willing to make a change. So you will have to make changes to your post-op diet. The interesting or the helpful bit about bariatric surgery is that it helps you make those changes. You are not alone in making those changes. So I don't think there is any food that you can't eat after bariatric surgery. The difference is the quantity of food that you will be eating. So instead of having a very large plate, you'll be having a smaller plate. Instead of having a very large spoon, you'll be using a smaller spoon. And that is how you lose the weight. You will not feel hungry. So don't think that you will actually feel very hungry but you won't be able to eat. You will naturally get satiety if you have these operations. So the dietary pattern changes, but it changes to a reduced quantity. You actually learn how to enjoy food more. You relish food more. You think about eating properly rather than just mindless eating. It is mindful eating. But yes, you can eat anything still after an operation once the first 6 weeks of the operation have been over. So we have another question. Will I need to take vitamin supplements and mineral supplements? Will I need to take is interesting. Do I have to take them? Do I need to take them? Well, anybody who's losing weight, I think, should be on some kinds of supplements. And for that matter, I think everybody can be on supplements. Now, I know that there's not a lot of evidence to say that in patients who are of normal build and are not having bariatric surgery, they don't need supplements. And I agree with that. But I think after gastric band surgery, bypass surgery, sleeve surgery, I would advise supplements. But especially after gastric bypass surgery, I think after bypass surgery, you need to be on lifelong supplements. The difference is with gastric band, you don't have to be on supplements. With sleeve, I think you can be on supplements for a short period of time and then we can stop the supplements. So we have another question coming over from Elaine. Are there any other kinds of foods that you can't eat after weight loss surgery? No, I think you can eat all kinds of foods. I would suggest do not have high calorie foods because that is not a good idea. That will essentially reduce the amount of weight that you're going to lose with bariatric surgery, but I think you can have all kinds of foods. So we've had some questions from Zoe. With your guidelines for the pre-op diet of 850 to 1000 kilocalories, can you have balanced meals and still be able to go ahead with gastric band as long as you're within the 1000 kilocalories per day? I think that's a very interesting question. You need to first understand why we asked you to do this. A lot of what we eat is stored in the liver. So anything that you eat, calories are converted eventually to glycogen. It is stored in the liver and it increases the size of the liver. The stomach is situated underneath the liver. If the liver size is very big, the surgery becomes difficult and sometimes you can't even do surgery. The reason we are sending you on the pre-operative diet is in order to reduce the size of the liver so the surgery can become safe, it can be quick, and your recovery is improved. Yes, you can maintain a very good balanced meal, still having 850 to 1000 kilocalories. We have a very good set of dietitians who work at Healthier Weight, along with specialist bariatric nurses, who will give you all the advice that you need in order to maintain a balanced diet. We have another question coming in. Do I have to follow a special diet after surgery? For the first 6 weeks, yes. So let's divide this question into two parts. What happens in the first 6 weeks and what happens after 6 weeks. With a gastric band in the first 6 weeks, the first 2 weeks you'll be on a fluid diet or a very puree type of diet. Then for the next 2 weeks, you will be going on to a semi-solid diet, going on to a solid diet over 6 weeks. So it's a transition period of 6 weeks where you should be going on to a normal diet. Again, when you have band adjustments, you will have to take a step back and go on to slightly softer textures and build them up again. That's the story with the gastric band. With the bypass and a sleeve, the first couple of days you are only on water and juices, clear fluids. Then you build up to fluids and any kind of fluids for the first couple of weeks. Then for the next couple of weeks, you go on to puree diet and then soft diet, building up to normal diet in 6 weeks or so. So for the first 6 weeks, there's graded diet going up from fluid to normal diet. After 6 weeks, I think you can have normal diet. It's just the pace you eat food at. It's how you eat food, how you think about food. So it's mindful eating, but you can eat everything. What I would suggest is don't have too many chocolate shakes or calories, because that will undo all your hard work. We have a question coming in from Claire. If a gastric band has failed, i.e. not much weight loss and slippage, can you still be successful with other surgery? Sweet things particularly are my downfall. I think you can even be successful with the gastric band. I think let's not say that the gastric band doesn't work. The gastric band can work. You need help, you need support. And at Healthier Weight, we can provide you with that help. We have specialist dietitians here. We have specialist bariatric nurses who can talk to you about your diet, who can teach you how to appreciate what you're eating, what the feeling of fullness is. What sometimes happens in gastric band surgery or in patients with any bariatric surgery, they start forgetting what fullness feels like, what gratification after food feels like. So we can help you do that. And there is nothing to say that, but still answering your question, will another surgery be successful? Yes. Well, the mechanisms of action of the different operations are completely different. The gastric band is more or less a mechanical operation. The sleeve and the bypass are very hormonal operations, and different kinds of hormones are working in those operations. So if one operation did not work, there is no reason why another operation shouldn't work. However, we have to bear it in mind that the data that is available for revisional surgery is not as good as primary surgery. So I think the weight loss may be slightly less, but I think we can even work with the band and get the same weight loss results. So that shouldn't be a problem. We have another question coming in from Mani Booth. Obviously, you need to change your lifestyle post-op, but are you still able to enjoy alcohol on special occasions? I think you can. I think that's very reasonable. If I was having bariatric surgery, I wouldn't want to get rid of alcohol completely. I think with the band you can have alcohol. With the sleeve you can have alcohol. With a bypass, you should remember that the alcohol will get absorbed very quickly. So you will get drunk pretty quick. So I think I would limit it after a bypass. But the more important thing, which you should think about, is what are the calories in alcohol? So let me tell you, being a whiskey drinker, I think there are 400 kilocalories in a glass of whiskey. So if you're having that, you're not having so many other things. So yes, you can have alcohol in moderation after any operation, but be careful. Another question coming in. Currently following pre-op diet, I'm worried that I'm having 1000 kilocalories with eating healthy. I will not be able to have my band. No, I think that's not true. I think I want good dedication. You have to try to lose the weight. The liver stores will get depleted when you go on a diet. Well, I understand it may not be 800, it could be 1000, but I think you will lose that weight pre-operatively and your liver will shrink. It is very rare that we cannot do the operation, but it is advisable you stick to the dieting guidelines that we provide you with, 800 kilocalories, because it will make your operation safer, quicker, and your recovery will be better. But no, at 1000, I think we should be okay. We have a question coming in from Ebony. How soon after surgery can I exercise, and what types of exercise should I avoid? So for all the operations, I personally get my patients up after the surgery and get them to walk. All of them go home walking, which means they don't actually go home walking. They go to their car themselves. Somebody drives them back home, of course. But when you get home, I have nothing against you going for half a mile walk for the first couple of weeks, or even a mile walk. So you can easily go for walking up to 6 weeks. I tend not to advise any strenuous exercise for the first 6 weeks because you have stitches. And although the wound may have healed from the skin, however, actual healing inside the body takes up to 6 weeks, actually up to 18 months, but 6 weeks, more or less, the healing is complete. So I say build up slowly with exercise after 6 weeks of having the operation, and you keep on building up. At any point, if you start having pain, just take a step back. You just have to be sensible about it. But if you have any trouble in your post-operative course, just give us a call and we'll tell you how to go about it. Another question coming in, what scars can I expect to have? Well, with all the operations, you will have around 4 or 5 scars. Most of these scars are 10 millimeter or 5 millimeter in size. So with a gastric band, you have 2 scars of 10 millimeters each and 3 scars of 5 millimeters. Now 5 millimeter, as you know, is very small. It will shrink down to 3 millimeters. 10 millimeters shrinks down to 7 millimeters. You will hardly see anything. With the sleeve, you have 2 scars which are 12-13 millimeters and the remaining 1 scar of 10 millimeters and 2 of 5 millimeters. And with the bypass, there are 4 scars of 12 millimeters and 1 of 5 millimeters. So with all these operations, you have 4 or 5 scars, more or less measuring on an average 10 millimeters or a centimeter in size. Of course, you have to remember that 1 in 1,000 patients may develop a problem during the operation and you may have to make a very big cut, but that is very rare. I think practically most of the operations are done laparoscopically these days. So another question coming in from Kerry. How soon can I drive after bariatric surgery? I think you have to sort this out with DVLA. The DVLA guidelines suggest that you should not be driving unless and until you are comfortable making an emergency stop. So if you think there is a bit of pain in your scars and that you will hesitate making an emergency break, then you should not drive. On an average, most patients tell me that it's a couple of weeks or so. Question coming in, can I have weight loss surgery on the NHS? Yes, you can. There are many hospitals that offer weight loss surgery. I can't tell you the total number. We are based in the West Midlands. In the West Midlands, there are 2 or 3 big hospitals and there are some smaller hospitals that offer, I think, total of 5 hospitals that offer bariatric surgery. In the NHS, you have to comply with the NICE guidelines. What the NICE guidelines say that you have to go to a medical clinic for at least 1 year if you have a BMI of less than 50 and for at least 6 months if you have a BMI of more than 50. You have to complete this follow-up in the medical weight management clinic. They will then clear you that you can proceed on to surgery or you're suitable for surgery, and then you will be put on an 18-week waiting list for surgery. So on an average, I think between a year and 2 years is the waiting time overall to get the surgery in the NHS. We have a question that's come in. With a gastric band, how long will the band last? Does there need to be a replacement or removal in future? Well, gastric band is meant for life, so I don't think you need a replacement or removal in the future. The band is designed to be in for the rest of your life. I have seen patients who had a band 13 years ago, 14 years ago, and they're still doing well, and they don't want to lose their band, they just want to have it. Obesity is a lifelong problem, so I think the treatment of obesity also has to be lifelong. Another question from Claire. Do patients have more successes if they follow a specific diet, i.e. weight to go? I think that's a difficult question. Preoperatively, I think everybody should go on an 800 to 1,000 kilocalorie diet or 600 to 800 kilocalorie diet, and you can do any diet you want. Weight to go is one diet you can do, but you don't have to do that diet. You can do any diet. These surgeries, these principles are applicable for all patients. You don't have to stick to only one set of rules. You can have any set of rules. Post-operatively, no, you don't need to go on a diet. That's the whole point of doing the operation, that you can eat what you like, but in moderation, and lose the weight. If you are going to be on a diet for the rest of your life, there's no point of having the operation. So we have another question coming in. How many fills on an average does it take to get the correct amount of restriction? Well, that's a difficult one. That's very difficult. I was hoping that nobody will ask that question, but on an average, I think between 4 and 6 band fills. It can be more, it can be less, it depends. It depends on how strong a feeling of restriction you get. It depends how you are getting on with your weight loss. It depends on the relative size of the stomach with respect to the band. It depends on whether you're male or a female. It depends on your weight. But I would say 4 to 6. But the bottom line is as many adjustments as is required to get you to your weight loss goal. So we will help you and continue to help you till the point you achieve your goals. We have a patient coming in from Claire. Do patients have more success? Oh no, I've read that question already. Will I have to stay overnight in the hospital after weight loss surgery? Well, it depends on what operation you're having. If you're having a gastric band, if you have a BMI of less than 50 and you don't have major comorbidities like sleep apnea or type 1 diabetes, I think you can go home the same day. What it requires is that there should be somebody with you that night. You can't stay alone overnight, and somebody has to pick you up from hospital. With a bypass and a sleeve, you have to stay in overnights. Bypass and sleeve are 2-night stay hospitals. So if you have the operation on a Monday with a bypass and a sleeve, if all goes well, you should be going home on a Wednesday morning. Claire has sent us a question. If I fall pregnant in the future, how does the NHS cover having the band deflated, or how much does Healthier Weight charge for it to be adjusted? If you fall pregnant in the future, you can have aspiration in the NHS, but it's a lengthy process. But I think everybody is entitled to NHS treatment, so you can get it deflated in the NHS. That is possible. However, if you want to get it deflated at Healthier Weight, we don't charge for it. We will deflate your band, and that's not a problem at all. Next question: if I've had a tummy tuck before, would that cause any problems with the gastric band operation? Not at all. I've done quite a few patients who had a tummy tuck before and now have a gastric band. It's not a problem. As long as I know about it and I'm not surprised during the time of the operation, I think it should be okay. The scars are very high up. It's not a problem. I don't think that would affect anything. More questions coming through. Sue. Hi Sue, how much will I need to be mentally ready to work with the band? I think you have come to this step of bariatric surgery because you have identified there's a problem. And the problem is that you're not happy with your weight. That took mental preparation. I think that took adjustment for you to understand that there's a problem and you need to sort that problem out. So mentally you need to be prepared. It is a lifestyle adjustment that you're doing. You will eat differently, you will feel differently. It's a change to your life. And for everybody, there will be a different time when they're ready for it. However, most patients tell me it's a very pleasant change. Their life is transformed and they're quite happy after the operation. But yes, I think you have to be mentally prepared. Do not go ahead with this operation if you're not sure, or if you are in a difficult place in your life. I think that's not the time to have surgery. You should be mentally prepared for it. What is dumping? Another question that has come through. Dumping is interesting. It does not affect operations like gastric band, or doesn't really affect operations like gastric sleeve. It mainly affects operations like gastric bypass, and even then the incidence is around 1 in 20 or so. Dumping is when the food enters the small bowel much earlier than it is supposed to. So if you have the normal anatomy, the food goes through the stomach and then goes into your bowel. In a bypass, the bowel is attached here, so the food goes directly into the bowel, and that changes the mechanics of the bowel. Now, that does not happen in every patient. Dumping causes rapid absorption of glucose, and as a result, insulin is secreted in your body, which causes hypoglycemia, which can cause a bit of dizziness. This can all be altered with different kinds of diets, so we can give you dietary advice if that happens. But again, luckily, thankfully, it's not that common after surgery. Is dumping dangerous to health? Yes, dumping can be very dangerous. So there are two types of dumping. There is early dumping and there's late dumping. And late dumping is when you get severe hypoglycemia after eating. That can be very dangerous. But thankfully, it is very, very rare. Less than 1% of the patients will have medically worrying dumping. So not a lot of patients have dumping, and there are dietary means to work around dumping. How to change your diet, how to change the fiber content in your diet, how to change the fluid content in your diet, and that would reduce the dumping. How to change the carbohydrate content of your diet. We have a question coming through. Do Healthier Weight offer any other weight loss treatments other than the band, sleeve and the bypass? Yes, we do. We offer the gastric balloon. The intragastric balloon is a fantastic endoscopic procedure for weight loss. We also offer the endoscopic sleeve gastroplasty, which is an endoscopic method of doing a sleeve. And we offer this as well. So I think we offer the full complement of operations that are available in the UK, or for that matter in the world. There are other operations like the duodenal switch, which used to be very common 20 years ago, or the biliopancreatic diversion, which have more or less faded away from the UK, and for that matter from the world. We are also going to start offering the mini bypass in the next few months, hopefully. How long, we have another question coming in. How long does the procedure take, band, bypass and sleeve? Well, I think the first and the most important question is, how long does it take to do the procedure safely? I think safety is the most important thing here at Healthy Weight. I think we want to do the procedure but do it in a safe fashion. I think a gastric band surgical time is around 40 minutes. For a sleeve, it would be between 1 or 1.5 hours. And for a bypass, it is between 1.5 to 2 hours. However, as long as it takes to do the operation safely is my bottom line. So if it takes 5 hours to do a bypass, then so be it, but it has to be done safely. There is no time limits when I'm doing an operation, or for that matter, when any other surgeon is doing an operation. Another question coming in, is there anything a patient can do to limit excess skin? Yes, excess skin is a problem. A lot of patients do complain of that problem, especially if they lose a lot of weight. I would not be put off from weight loss surgery because of excess skin, because you are having weight loss surgery for the health benefits of weight loss surgery. It is not cosmetic surgery. It is weight loss surgery because it reduces your risk of developing heart disease, reduces your risk of developing diabetes, hypertension, sleep apnea, raised cholesterol. Those risks are being reduced and it is improving the quality of your life. However, if you do get excess skin, exercising will help with excess skin. Worst case scenario, if you still have excess skin and you are not happy with it, we can refer you for in-house cosmetic or plastic surgeons. Another question coming in, how long do I need off work for each procedure? Depends on the kind of job you do. So if you told me that you were a manual laborer and all day long you are lifting 50 kg to 100 kg weights, then I would say you need 6 weeks off. But if you're doing a desk job, I think 5 days is enough. So if you have an operation, let's say on a Saturday, you take the week off and you're back on a Monday. So you get around 9 days off really. And that's more than enough. But even if you're having the operation on a Monday, I would be happy for you to go to a desk job on a Monday. But then again, we have to be reasonable about it. If you're not feeling well, then don't go back to work. Firstly, let us know if you're not feeling well. And if you're not really feeling well, then don't go to work. But I think you should be able to go back to a desk job within a week. Worst case scenario in 2 weeks with all the operations. We have another question coming in. What happens if something goes wrong? I think that's a very important question. That's one of the most important questions I can think of as a surgeon. There is a complication rate associated with every operation. So there's a risk of minor complications, major complications, or other things with every operation. And no surgeon can say that do not have complications. No provider can say that they haven't had any patients who've had complications. I think complications will happen and will continue to happen in the future. The most important thing to know is whether we are equipped to deal with the complications. Do we know how to recognize the complications? And do we have a team who can sort out those complications? Yes, we know how to recognize those complications. And yes, we have a team to sort out those complications. And with the Healthy Weight warranty, we will do all of these, we'll sort out all of these complications in the package that you had come up with originally. Thank you for your questions and thank you for watching. We hope you found this informative. If you have any questions, feel free to give Healthy Weight a call on 0121 693 4488. Let me repeat this, 0121 693 4488. Nice talking to you. Thank you.